Inflammation is a natural biological response of the body's immune system to harmful stimuli such as pathogens, toxins, or tissue injury. It is a complex process involving various immune cells, blood vessels, and chemical mediators that work together to remove the harmful agent, repair damaged tissues, and restore normal body function. The inflammatory response typically involves 5 key signs: redness, swelling, heat, pain, and loss of function. These symptoms are caused by the release of chemical mediators such as cytokines, prostaglandins, and histamines, which increase blood flow to the affected area and promote the migration of immune cells to the site of injury and infection. While inflammation is a vital process for fighting infections and promoting healing, chronic or excessive inflammation can be harmful and may contribute to the development of various diseases such as arthritis, diabetes, cancer, and cardiovascular diseases. So the big question might be, what causes inflammation? Inflammation can be caused by various factors such as infections. Pathogens such as bacteria, viruses, and fungi can trigger an immune response that leads to inflammation. Tissue injury, physical trauma, burns, and surgery are also another cause of tissue damage that triggers inflammatory response. Exposure to environmental toxins such as cigarette smoke, air pollution, and industrial chemicals can cause inflammation. If toxins get too far into the lungs, they can get absorbed in the body or cause inflammation in the lungs. Inflammation is the body's way of sending cells and chemicals to try and destroy the toxins. Autoimmune disorders. In some cases, the immune system mistakenly attacks the body's own tissues, leading to chronic inflammation. An abnormal inflammatory response is involved in the majority of acute and chronic conditions, with strong evidence linking chronic inflammation to the pathogens of autoimmune disease. Many factors contribute to stress, but whatever the cause, stress creates a hormone in your body called cortisol. Cortisol can suppress your immune system effectiveness in fighting off invaders by lowering the number of lymphocytes present in the blood and interfering with normal white blood cells communication. A poor diet can alter the bacteria that live in your gut, and that alteration has the ability to interact with your immune system, eventually trigger it in a way that leads to chronic inflammation. Also, excessive alcohol consumption contributes to systemic inflammation by interfering with the body's natural defenses against the influx of gut microbiota and its products. Another factor is aging. Aging is associated with the development of a low-level systemic chronic inflammation known as inflammaging. This chronic inflammatory state can contribute to diseases of aging such as sarcopenia and frailty. The presence of inflammaging suggests a failure of the cell clearance mechanisms that ordinarily aid in the resolution of the inflammation after pathogen infiltration or tissue injury. Some genetic mutations can cause an overactive immune response, leading to chronic inflammation. Your DNA tells your body how to form and function. Genetic mutations can lead to genetic conditions like cancer, or they could help humans better adapt to the environment over time. Immune activation in hypertension is characterized by activation of dendritic cells and subsequent activation of T cells. The T cells then migrate to the vascular tree and the kidney, causing inflammation and hypertension. It's important to note that while acute inflammation is a normal response that helps the body fight infections and heal wounds, chronic inflammation can contribute to the development of many chronic diseases. Before proceeding, kindly hit the subscribe button and give this video a thumbs up. Now that we've understood what inflammation is and the causes thereof, Let's look at several natural remedies that can help reduce inflammation in the body. The number one is turmeric. Turmeric contains a compound called curcumin, which has potent anti-inflammatory properties. Adding turmeric to your diet or taking a curcumin supplement can help reduce your inflammation. Omega-3 fatty acids found in fatty fish, flaxseed, and walnuts inhibit an enzyme called COX, which produces the prostaglandin hormones that spark inflammation. Ginger, known to many, contains compounds called gingerols, which have anti-inflammatory properties. Some laboratory and animal studies have found ginger extracts can reduce the production of several chemical substances that promote joint inflammation. Ginger also contains salicylates, which your body transforms into a chemical substance called salicylic acid. The compound majorly responsible for ginger's medicinal properties is gingerol. As the main bioactive compound, research indicates that gingerol may reduce oxidative stress, which is a result of having excess inflammation in the body. Aim for at least 30 minutes of moderate exercise most days of the week, as regular exercise reduces fat mass and adipose tissue inflammation, which is known to contribute to systemic inflammation. Sleep. During sleep, blood pressure drops and blood vessels relax. When sleep is restricted, blood pressure doesn't decline as it should, which could trigger cells in blood vessel walls and activate inflammation. A lack of sleep may also alter the body's stress response system. The next is probiotics. These are found in fermented foods like yogurt, kefir, and sauerkraut, which help in reducing inflammation. Probiotics have also been shown to promote healthy aging by indirectly mitigating age-related inflammation. That is done by promoting short-chain fatty acid production or directly reducing the production of pro-inflammatory molecules by immune cells. Bone broth from chicken specifically, not beef or pork or fish, supports joint health through the chondroitin sulfate and glucosamine found in cartilage. It's a good source of anti-inflammatory amino acids like proline, glycine, and arginine. And for a drink, we have green tea, which contains a compound called epiglycocatechin gallate, which has anti-inflammatory properties. Drinking green tea or taking a green tea extract supplement will help in reducing inflammation. By making healthy lifestyle choices, you can help reduce the risk of inflammation and the many chronic diseases associated with it. Thanks for watching.